I'm Dr. Snehal Mallakmir, clinical geneticist at Apollo Center for Genomic Medicine. In few previous videos, we have got introduced to terms related to genomic medicine. And one of the specialty where genomic medicine is very useful is fertility genetics. At Apollo Hospital, we have a fertility center dealing with infertility, male and female infertility, and various aspects of it. Some part of it is related to genetics. So that is where fertility genetics is gaining importance. In case of infertile couple, the pregnancy is very precious. And in that pregnancy, we, apart from pregnancy problems, apart from other factors which are causing difficulty in pregnancy, we have to also ensure that the baby which is born is healthy and is also not associated with any genetic or congenital defect. And to ensure this, we have certain testing or we have certain protocols so that we ensure that this precious pregnancy outcome is healthy. And hence, we have certain tests like non-invasive prenatal testing during pregnancy, which from which we can screen the embryo, we can screen the pregnancy of the fetus for chromosomal abnormalities. Then we have some of the genetic screening for some male or female genetic factors. And another new thing which is is gaining acceptance is pre-implantation genetic diagnosis. In cases with the families where they have already a genetic disease in the family or the previous child with known genetic disease, and if we know the final diagnosis in the previous child or the family member, then not to have the recurrent experience of the similar disease in the family, the pregnancy choices are available. Like if the couple wants to have an infertility IVF baby through an IVF procedure, then the embryo which is formed through IVF is tested for the genetic disease, and if it is normal, then it is implanted into the uterus. That is called as pre-implantation genetic diagnosis. This means that we ensure that the genetic defect, maybe it chromosomal aneuploidy, that is chromosomal abnormality, all various genetic diseases which are known, they are not recurring in that particular pregnancy. It is called as pre-implantation genetic diagnosis, which is available at Apollo hospitals. For example, thalassemia, which is a very common disease and common mutations are present in the community. So if previous babies are having thalassemia, or if couple is known carrier of thalassemia, then before planning the pregnancy, they can visit us and they can clarify for these options of pre-implantation genetic diagnosis, where we test the embryos, and if the embryo is normal or carrier, normal for the disease or carrier, then the embryo can be implanted. Apart from this, as I have told you that in fertility genetics, we have many genetic disorders related to or causing infertility. So patient to patient basis or couple to couple basis, we have, depending on the history of the couple, depending on their own profile of investigations, we then go ahead and decide whether any genetic factor is present. So anything related to infertility or any queries related to genetics related to infertility, please visit us at Apollo Center for Genomic Medicine and our Fertility Center, whether we will definitely ensure to get you the updated information about it and various pregnancy choices and the procedures and investigation related to it. Thank you.